Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. Before I will start, can I ask for your complete name and date of birth, please? Okay, very good. I'll just have to sanitize my hands. Would you mind if I'm going to stand beside you as I will do my vital signs and check for your ID band for confirmatory purposes? Okay, thank you. Can you lean a little bit forward for me, please? Okay. Neatly. Very good. Continue. Okay, continue. Okay, very good. Okay, very good. Okay, so I just have to check your heart rate and also your level of saturation. I have here a portable pulse oximetry. Then check your ID band. Okay, correct name, correct date of birth. So I think we're done taking up your heart rate and also your other vital signs. So the purpose why I'm here today, because the doctor ordered you a breathing treatment. So there will be 3 different breathing treatments that I'm going to give you, and then the breathing treatments that I'm going to administer to you is both anticholinergic and adrenergic. So which means both of them are bronchodilators, which would help for your relief from any airflow obstruction and at the same time decrease your sputum production. So the first medication that I'm going to give to you is via a small volume nebulizer. So this medication is what we call a Sopenex, and it was being ordered for 3 times a day, and it has an effect of, it would last for 8 hours. So here is the medication that I already prepared for you. So this one is through a small volume nebulizer. So as you can see, I have here inside the medication. So all you have to do first is to position this one inside your mouth with your lips sealed, and then when you put this one inside your mouth, your tongue should be here underneath or below. Do not obstruct the mouthpiece. And then once you're going to start, all you have to do is do normal breath. Try to observe me first, like this, with occasional deep breaths. Okay, so sounds good. So let's start already. Okay, put inside your mouth here with a compressor base. So do normal breathing. Okay, very good. Continue with occasional deep breaths. Okay, so I think we're done already taking this up. So I'm going to let you rest for a few seconds until a minute. So I just put this one on the side while I'm preparing for the next dose. And by the way, can you inhale deep and at the same time cough for me, please? Okay, very good. So I think we're done letting you rest for about a minute. So the next medication that I'm going to administer is through a meter dose inhaler. So the medication that I'm going to give is what we call the Ventolin. So this medication is being ordered for PRN use only, which means these are not to be used during maintenance medications. So this one should be used also when it comes when your trigger of asthma would occur, or if ever you're having some shortness of breath. So please do not use this one during maintenance medication. So this one is a meter dose inhaler. So as you can see here, try to position your thumb, your index finger at the top, as this would be the guide to press or actuate the device. And then your thumb should be below, as this would be the support during how to hold the device. And then after that, you first do a exhale all your air out. It should be away from the device, like this, until you feel your lungs are empty. And then after that, try to shake the device. After shaking the device, press or actuate the device at least once, like this, and then put this one inside your mouth. When you put this one inside your mouth, try to seal with your lips, and also your tongue should be here also below. Please do not obstruct. Okay? So can we proceed now? So I just have to do this for you. Exhale first all your air out. Okay, very good. Going to shake the device and then actuate. Okay, so I'm going to put this one inside your mouth. I'm going to count 1, 2, 3, and then I say 1, 2, 3. Inhale. And then hold your breath for a few seconds, at least 10 seconds or as long as you can. Hold your breath, and then remove the device and exhale normally away from the device. Very good. So, can you breathe deeply and at the same time cough for me? Okay. So, by the way, those two medications have its own side effects. So, specifically in your heart, so it might lead you to some side effects of tremors, palpitations, or nervousness, or even some headaches. So, those are very normal, but unless those symptoms persist, just don't hesitate to inform us. Okay? So I'm going to let you rest for a few seconds until a minute, and then we're going to proceed with the last dose. So I think we're done letting you rest for about a minute. So the last medication that I'm going to administer is through a different type of inhaler. This one is what we call a dry powder inhaler. So the other medication that I'm going to give you is Incrus Ellipta. So this one is Anticholinergic. So it will help decrease your sputum production, and it was being ordered at least for 1 inhalation daily. So it is a long-acting agent, and it will last for 24 hours. So the difference with this inhaler with the previous one is that this one is a mode through a powder form based inhaler, unlike with the previous one, which was a liquid form of solution. So all you have to do first is you have to exhale all your air out until you feel your lungs are empty. And then after that, you can see, try to twist this inhaler until you feel or hear a click sound, which means it's ready to use. And then put this one inside your mouth with your lips sealed. And after that, you inhale deep. Hold your breath for about 10 seconds or as long as you can. And then after holding your breath, remove the device and exhale normally. Very good. So I'm going to start. I'm going to lift, okay, put inside your mouth. Then I'm going to count 1, 2, 3 and inhale deep. Hold your breath. Very good. Hold your breath. Hold your breath and remove the device away from you and exhale normally. Okay. So can you breathe deeply again for me and cough at the same time? Okay, very good. So I'm going to let you rest for about a minute, and then I'll just have here a glass of water to let you rinse your mouth. So rinse your mouth, don't swallow it, and then expel all those water inside. So the reason for this is because the side effects of that medication would lead to dry mouth. So that would prevent from doing it so. So I just have to sanitize my hands. So now that I'm done letting you rest, would you mind if I'm going to double check your vital signs again? Lean a little bit forward for me again. Okay, very good. Very good. Just have to check again your level of saturation and also your heart rate and respiratory rate. So I think we're done taking your heart rate already. So another information that I will just have to let you know is that for the proper cleaning of the device, so the nebulizer, as you can see here, this one is the nebulizer kit. You have to, each one of it, try to remove one of them each part of the device, and you should rinse it with sterile water. Do not rinse it with tap water because it might lead to contamination. And then once you're done rinsing it, just put it to the side, let it air dry, and put it in a clean paper towel. And another thing is, as you have noticed the tubing earlier with this device, please just put it aside, do not rinse it with water. And then another thing to note is with the inhaler, especially for the meter dose inhaler, as you can notice there is a dose counter where you can see if how many dosages would you need to do until you can know that how many dose would be remaining. And then you should both position it upright and store it in a room temperature. Okay, so is there anything else that I can do for you, or any questions about the breathing treatment we did right now? Okay, so please don't hesitate to call us if ever you have any questions or regarding the symptoms, so that both our department and even the physician can discuss on how to alter the dosage and its frequency. Thank you so much and have a good day.